Hi, I'm Dr. Brian Miller from the Wellness Center in Montrose, California. You're watching this video because you're either suffering from a thyroid issue and you're frustrated, or a loved one is. So I'm here to give you some answers. I've been in practice since 1987. I've dealt with functional issues that whole time. We look at things a little differently than most offices. We look at you functionally and metabolically. Why? Because it could be a neurological condition, the brain misfiring, nerve imbalances, but it could also be a metabolic issue. It could be an immune issue. It could be a parasite. It could be a food allergy. Because here's the deal. Look it up. 90% of thyroid conditions are not thyroid conditions. They're autoimmune conditions. It's your own body attacking itself. It's called Hashimoto's disease. And if all you're doing is medicating it, you're not getting to the cause of the problem, and it's going to get worse. You see, if you never get to the cause of the problem, and all you do is cover up the symptoms with medication, you're going to run into more problems down the road. I'm not saying get off your medication. What I'm saying is find out what's causing your thyroid condition. You didn't catch it. You developed it. Something caused your body to attack itself or create a hormone imbalance. So what do we do in our office? Well, what we do is look at your old blood work. Bring in all your old blood work, because we look at that even differently. See, most blood panels are done from a pathological level. They're waiting until you have a disease before they tell you, oh, your markers are high. Well, we look at what's called a functional range. There are narrower ranges of what the panel should be, like in a thyroid for TSH. We want to look at the 1.8 to 3.0. It's a much narrower range. If it goes over 3.0, you're heading into a hypothyroid range. Now, in the pathological lab community, which is the regular blood test that you've probably already had, it's not until you hit 5.0, and that's already way too high. So what they're doing is they're waiting until your labs are so high you already have the disease. We want to catch you in that range before you develop the disease. But if you already have the disease, if you already have the thyroid issues, we can still help you with that. And that's where we do our own specialized immune testing. We look at there's two parts of the immune system, right? And if one's out of whack, one's stimulated too much, this one or this one, your body is going to attack itself. And there's another thing called dysregulation that could be from improper insulin levels or dysglycemia, blood sugar problems, which one way to tell is, how do you feel after you eat? You get tired? That's insulin resistance. How do you feel after you eat? Do you get excited or you get energized? That's hypoglycemia. You see, you shouldn't feel a thing after you eat. You should just feel hungry and then not hungry. That's one way to tell. But what I recommend is you get a book called Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? You see, people are going to have normal lab tests that have all the classic symptoms of hypothyroidism. And that's probably the most frustrating of all. Doctors saying we can't find anything wrong with you. Well, they're not doing all the testing. So what I'm saying is, please fill out the 2 visits below, and what we'll do is get you a free report on thyroid issues. I'll send you a DVD, and we'll schedule you for 2 visits with me. Your first visit's going over all your old lab work. We actually put it into a computerized program that puts it in functional ranges, and we can see exactly what's going on. The next visit is we put a plan of attack. We want to figure out what we're going to do to get you better, because we can help you. Thank you.